What is a statin drug? In this Your Heart in 90 Seconds, I will explain what statin drugs are, how they work, and what they are most commonly prescribed for. Don't forget to subscribe and click on the link so that you get notified when we release a new video. So we're going to talk about statin drugs. Now, they are one of the most commonly prescribed medications in the world, but they are also one of the most controversial medications in the world. And it has to do with side effects, and we'll get to that. Statin drugs are prescribed to try and prevent people from having heart attacks and strokes. They lower your bad cholesterol, and that's the cholesterol that builds up in the walls of our arteries and can cause us to be at more risk for having heart attacks and strokes. So they're generally prescribed for people that are at high risk, so people who have a strong family history, have higher cholesterol, or have diabetes. They can also be prescribed, or should be prescribed actually, after people do have a heart attack or a stroke, because we know that once you've had one, you're at much higher risk of having a second one. So we need to do something to change your risk so that you don't have more heart attacks and strokes. They primarily work to lower your bad cholesterol by working on your liver. And so it blocks one of the pathways in our body that our liver uses to create cholesterol, and so our LDL and our total cholesterol in hand go down. So I'm going to talk about side effects. I'm going to start with the more serious ones. One of the biggest serious side effects is called rhabdomyolysis. It's actually muscle breakdown. And when our muscles break down, they actually can cause our kidneys to fail, and they could end up eventually leading to death. It's exceedingly rare. It's a couple of cases in a million, but it is something that could potentially happen. Another rare side effect is that it can cause liver failure. Because it works on your liver, it can sometimes cause your liver to fail, especially a higher risk if you're older or if you drink a lot of alcohol, and there's a couple of other things. So generally what doctors do is they check your liver function with blood tests after you start a statin, just to make sure. Personally, I've never seen anybody have rhabdomyolysis or liver failure. I've seen lots of people on statins. I work in cardiology. I have, though, however, seen lots of people stop their statins because they get minor side effects, or they feel they're doing better, or whatever it is, and then they come back with another heart attack, or needing another stent, or needing bypass. I see that every week. So the more common, well, I'll talk about one more side effect. It can also possibly raise your blood sugar. It tends to happen more in people who already have elevated blood sugars. So interesting though, if it raises your blood sugar and pushes you to being a type 2 diabetic, you're generally treated with a statin anyways, so it's unclear whether it's really that bad of a thing to raise your blood sugars, because you probably should be on a statin anyways. The most common side effect is muscle aches and pains. They can be minor. Sometimes people report that they can be more of a problem and cause problems with your daily activities. So you shouldn't just stop your medication. You definitely need to talk to your physician because of the bad ramifications of stopping a statin drug and having heart attacks. But there may be some changes they can do, whether it's lowering the dose, having you take it every second day. Sometimes they will even, if it's really bad, switch you to another type of cholesterol lowering medication. But unfortunately, those medications, even though they lower your cholesterol, haven't shown the same benefit as far as preventing heart attacks and strokes. So there are things to be done. A reminder, this is me talking about medications, not me prescribing medications. You should definitely not start, stop, or change medications based on this talk. I'm just trying to give you information. So I do hope that you found this information helpful, and we will talk again another time.